Do not try this at home. Hey everyone, today I'm going to react to Troom Troom medical videos. Troom Troom is a huge YouTube channel that started out doing life hack videos. Now it's evolved into doing situational type videos that are really funny. So now we're going to take a look at it and see what it's all about. But before we get into it, I'm Dr. Jordan Wagner. Thank you so much for coming to my YouTube channel and checking out all these videos. The reason I made this channel was because so many patients and my family members were asking lots of medical questions. So what better way to answer them but to make a video that everybody can watch and enjoy, and laugh at some of the TikTok React or Troom Troom React videos. As always, please make sure you subscribe and turn your bell notifications on. That way you're instantly alerted when I post a new video. Now, let's get into it. Alright, so let's check out clip number 1. Alright, doctor's office. Oh. First off, yes, this is true. People come into the ER, the doctor's office, freaking out that the ailment is horrible, so we gotta check it out. Cut off the bandages. It's like before we take it off, it's like a bad Christmas, like you're trying to figure out what's under the wrapping, what's the gift that we have to deal with that day or take care of that day. Oh, jeez. It's a tiny little scratch on this arm. Oh my gosh. This happens all the time in the emergency department where somebody comes in with what they believe is a horrible wound or an injury and it hurts them a lot. So we address it. We have to address everybody's pain, concerns, all of that things. And it's appropriate to take a look at it. So we'll put a bandage on it, sew it up, and send everybody on their way home with whatever pain medications that require for that injury. Also, can we just mention that the doctor took off the mask to treat the wound? So she put the mask on for the patient to come into the office, but then treating the wound, she took off the mask. Probably not the most appropriate thing to do. And the patient's not wearing a mask either. In the age of COVID right now, patients and doctors and nurses and all staff in the hospital are wearing masks. Whoa. This patient's got a ton of wounds all over her body. I don't know what's under them. What? Nobody's wearing a mask. Oh my gosh, there's M&Ms and candy underneath? Like, come on. But in real life, this video hits a little too close to home because you know how many times I've found sandwiches, different types of food and other objects in crevices in patients when they're on the hospital gurney? More than I can count on my hands, let me just tell you that. What I can also tell you is I also would not eat any of those pieces of food that I found on anybody. Gross, weird, next video. Okay, alright, here we go. Alright. Oh my goodness. So patient's coming in with an injured arm or a broken arm and the doctor's bending it back and forth. Yes, sadly we do that to confirm that there's a problem. We apologize for this and we apologize for causing more pain, but we do need to check to make sure that pulses are intact and seeing if we can feel the injury. Let's see where it goes from here. Oh, triple fracture specialist, okay. Oh my gosh. A triple fracture, I don't know what they mean by that, but using a magnifying glass to pretend to look at something, we don't do that either. We look at x-rays. Let's see what they got. Oh. Oh my goodness. Oh my gosh. Okay, come on now. So, one, that's why we do the physical exam to see if there's a problem, and you would notice that right away. But we actually get patients' friends or family members that do try to sneak into the emergency department. One, that's dangerous. One, we have security guards to prevent that from happening because people could bring weapons in, not just food. We don't allow patients to typically eat in the emergency department when we're continuing to try to figure out what's going on with them. God forbid they're going to have surgery, the patient needs to have an empty stomach. Having an empty stomach, because if you get sedated, breathing tube in, and you're laying flat, you increase your risk of aspirating whatever's in your stomach contents into your lungs, which can cause pneumonitis, which is inflammation of the lungs, and then can cause pneumonia, which is infection of the lungs. So you can't do that. I have a ton of hilarious stories where patients and friends or family members or loved ones do a lot of weird things in the hospital ER room. And that's where I'm going to leave it. All right, let's go to the next video. Oh, choking. Whoa. Do the Heimlich maneuver. No. Oh my gosh. Okay, it's partially true. So if the child is young, probably where you can hold the child in your arm, yes, you flip them upside down, you can smack them on their back to try to expel whatever's stuck in the throat. But most of the time you do what's called the Heimlich maneuver, and we've all seen this or heard about it, where you basically are behind the person and you take your fist and you put it where the stomach is, right below the ribs, and you forcefully push in and up to try to force air from the stomach out through the esophagus to kind of expel whatever's stuck in the throat. You don't try to blindly grab in the mouth. You don't try to flip somebody upside down. You can injure them further, drop them on their head, that sort of stuff. Do not do this at home. Try not to flip anybody upside down. It can cause more harm than good. In the end, get the object out. If not, get to the hospital as fast as you can. Oh. Ooh. Ah. That's pretty good. So, bad splinter, Elmer's glue is good. You put it on the splinter, let it dry, and peel it off. It'll come out. You can do this even with bee stings as well when the stinger's stuck in there. So, great technique. Obviously, use tweezers if you have them as well, but sometimes they're too small or you can't see it, and putting on Elmer's glue, it's a fantastic idea. Duct tape is another fantastic tool. It's very sticky. You put it on it and it can peel right off. Here we go. All right, we're in the kitchen. Oh! I've done that a lot. Whoa. Oh my gosh. What? All right, okay, putting a pad, it's absorbent so you can fill it with fluid. Okay, I see what they're doing. Let's check out more. Okay. Actually, that's pretty impressive. So that's basically making an ice pack with the tools that you have at the house. I don't think you need a needle and syringe to be able to do that, but anyway, you can get some water into that pad to fill it up, freeze it so now it's an ice pack. You can also just fill a bag up or a towel up with ice and put it on the same object. Try not to put ice directly on your skin because it can cause type of burn to your skin. The ice will decrease the inflammation and it will also numb the area so the pain won't be as bad. So great hack. There's a good life hack. Obviously, if you smack your head that hard, if you lose consciousness and you're not acting right, make sure you get seen by a healthcare provider. Alright, that was a quick react video with me, Dr. Wagner, to Troom Troom medical videos. That was hilarious. Do you guys want me to make more react videos? Let me know in the comments. Do you guys have any crazy, cool life hacks that you do at home? Please let me know in the comments. I can always use a few extra myself. Make sure you subscribe and turn those bell notifications on. Thank you so much for watching and stay healthy, my friends.